What is it going to take to make long-term care solutions or a solution at the federal level a top political priority in this country?
I really do think that things happen when there is an unstoppable demand for things to actually happen. And part of that unstoppable demand is to do the local and state organizing that sort of says, we have made this happen in, name the state, Hawaii. And then from Hawaii to Oregon to someplace redder than Hawaii and Oregon, because the people in those red states face the exact same issues that everybody else does.
Turns out we're all human.
Turns out, surprisingly enough.
Human beings. I'm wondering, in all of your years of doing aging policy work and watching the field, what lessons do you have for our organizers and advocates on the ground who are trying to win this very bold change? In this political climate, it's actually quite courageous and bold.
Right. It is quite courageous. I think the first lesson is that people have to get beyond sort of thinking about this as just a partisan issue. And it's what we talked about before. It's I love that phrase, transpartisan issue, that there is something in all of this for everybody, and that's the key to be used to appeal to policymakers, that we're not just talking about putting money in the pockets of people because you're eliminating taxes. What you're talking about is making it possible for people to actually continue to earn their livings as a result of people getting support in their caregiving. I think that's a powerful argument if you frame it. I think that a powerful argument is how this, in fact, does end up saving policymakers, saving the state money. And if we think about lesser interventions, if we think about training caregivers better, ensuring their tenure, doing things like home modification so that the caregiver can work in a better work environment, better workplace environment, then we ultimately end up saving things like Medicaid money because we're not spending as much money for more expensive interventions. And in fact, we were able to demonstrate that in one of the projects. What we found was that of 2,400 caregivers that about 400,000 people were served in this family and informal caregiver initiative. 2,400 we have really good data about. Of those who were caring for nursing home eligible care recipients, those that received things like home modification ended up having fewer admissions to the hospital. Ended up having later admissions into long-term care facilities, all of which added up to millions and millions and millions of dollars of savings to the Medicaid system, all of which cost considerably less. And a home modification, an average home modification, grab bars and ramps, $2,000, $2,500, as opposed to a day in an emergency room, which is $18,000, right? Or a month in a nursing home, which is what these days? It's, I don't know, $20,000, right? Depending on where you are, right? All of which save money. Training caregivers to a higher standard, paid caregivers to a higher standard, so they have the knowledge of professionals as they actually are, and they can use that in bargaining higher wages, frankly. Costs what per caregiver? $2,500, $2,000. Train people better, right? Saves millions of dollars because they are able to see the kinds of issues that are emerging and are able to get help sooner.
Right. And is there a role for the private sector here?
What is it? Of course there is.
What is it?
You know? Well, somebody's got to be able to put those resources into the community. I mean, if we had a private, if we had social insurance, which then hires people, which then allows people to do that kind of caregiving work, they've either got to work for companies or for cooperatives, like there's a shout out to the Bronx Women's Home Care Cooperative, or as sole practitioners, and all of that are potential for people to make money. It creates jobs.
It creates a lot of jobs.
A whole lot of jobs, right?
Which are not going anywhere because technology is not going to displace these jobs anytime soon, contrary to what a lot of people say. And they're not going to get outsourced.
Right. Technology actually is not going to replace these jobs, I think, for the most part, period.
So there's a lot of talk about the jobs crisis and how technology is actually displacing a lot of forms of work. But this is one.
Where it's not going to. Right. This is work that we can count on.